We're now going to have a look at the Wendylett bed system. So we've got the Wendylett sheets here, but we do also have SIBA bed system sheets within Sirona as well. With this bed system, it's really important that a risk assessment has been done and a review of the equipment, and also a moving and handling plan for any special requirements that are needed with patients. Whenever the bed system is not being used, it should be locked off, like you can see here. So the sides of the sheet should be underneath the mattress if possible, and the bottom of the sheets should be folded over and locked into place as much as possible. This is a bed system and it's under the patient 24/7, so it does carry quite high risks with it, because the two slidey sheet bits of material, the satin, can be very, very slippery and can result in patients falling off the bed if all those risk assessments haven't taken place. So first thing we're going to do is untuck the sheets, because we're going to slide the patient up the bed, because the patient has slid down the bed in between visits. So we're unfolding that bottom end fold, taking it out of the bed. I can see here that to prevent any shearing of the lower limb and the heels, I'm going to put another slide sheet just underneath that lower limb area. So this technique can be done with assistance of 2 or assistance of 1. At the moment we've got 2 carrying out this technique. So what we're going to do is we're going to take a nice handful of material, and both of us either side of the bed in our fab stance. So that's flexion of the knees, alignment with the head through the spine, and a good centered base. On the word slide, we're going to slide the patient up the bed. Ready? Yes. Ready, steady, slide. So it's meant to be a very controlled slide, only a short movement that you're doing. It's not about whizzing the patient up the bed in an uncontrolled manner. It needs to be very controlled and slow. We're going to have another slide down the bed this time. So exactly the same thing, either side of the bed, holding a good amount of material in our fab stance. Ready, steady, slide. And then one more slide, so that you can see exactly what's happening. Again, a nice handful of material, and ready, steady, slide. Good. And then once you're done, we're going to be locking off the sheets. We want to make sure that they're as flat as possible as well. We don't want too many folds of that material underneath the patient. So we're folding back as much as we can, really, underneath, just at the tops of the legs. Okay. And tucking under the mattress, aiming to keep the patient as safe as possible